trial it just for 4 weeks, no benefit for you, ditch it.
Right.
I think that's what we need to start doing. Essentially, we've been using them incorrectly. Well, it's like if you have any issues, right, and you're like, I want to try a probiotic, or a company saying, look, this is for women's health, you need to ask them, has there been a
supplements?
Yeah.
So supplements is something that comes up so often. It's possibly like the number one question that I'm asked about lifestyle is like, what supplements do I recommend?
Yeah.
So I'd love to know what you say to patients when they ask you.
Yeah, really good one. So there actually has been a little bit of research looking at things like omega-3. So ideally we would get omega-3 from oily fish. But there has been studies showing that, having enough omega-3 has reduced some things like hot flushes in menopause. So always I'm saying like, try get your 2 serves of oily fish, which is, your salmon, herring, mackerel, sardines in a week. And if you're doing that, you don't need a supplement. If you aren't into fish and you can't go there, that actually is worth considering an omega-3 supplement in those scenarios.
Can you get omega-3s that are not fish based?
Yes. So algae oil.
Right.
Yeah. So if you are vegan, avoiding animals for that reason, then algae oil's got the right EPA and DHA, which are 2 types of the omega-3 that most other plant-based sources, so things like chia seeds, contain the omega-3s, but not those EPA and DHA, which we kind of need for things like our mental health and are more thought to be more beneficial for our gut health as well.
Okay. And any other kind of mineral supplements or vitamin supplements?
Yeah, so magnesium is one that you hear a lot about in sleep, and there has been some studies looking at magnesium L-threonate, and there was one clinical trial I think from last year which showed that actually can have a benefit for sleep. Again, that one was not in people going through the menopause or postmenopausal women in isolation. So that would be an extrapolation, but I definitely know from anecdotal evidence that it can help with sleep as well. So that might be one to consider. But again, I think because there's so much else going on with the menopause, like I would try, magnesium-based foods like, the nuts and seeds maybe before bed and seeing if that helps. Because I don't want to load in all these supplements. Sometimes they can like interfere with each other. But that could be one if that's specifically a struggle of yours. So what I would do is trial it just for 4 weeks. No benefit for you, ditch it.
Right.
I think that's what we need to start doing. Trialing, have a benefit, great. No benefit, then ditch it on your specific outcome. If there's no strong overall evidence for it, I would say. All the studies out there is showing that supplements in the form of food is going to be much more effective than if you get it from supplemental form. So that's kind of my typical advice. And then there's also research around phytoestrogens. But again, if you're having your tofu, your soybeans, again, the studies showing improvements in menopausal symptoms have been about half a cup of soybeans each day. Then again, you don't need to take the phytoestrogens. And in fact, in the supplement form, I think the research is a little bit more like positive studies, negative studies. So I'm kind of like, I don't like to go down that way too much.
And spread, would you say every day, or would that work if you kind of had it a lot on 3 days a week, or how
the phytoestrogens?
Yeah.
I mean, again, just keeping to the studies, it's daily. And I think we need to get people thinking that way to like keep up the habit and also to reduce gut symptoms. Because if you think of how a lot of these things work, it's feeding our gut microbiome those phytoestrogens. They're the one who turns it into kind of like those estrogen-like molecules. If you starve our microbiome, because they're like us, they want to be fed 3 times a day. If you starve
they're
them,
alive, right?
Yeah, they can actually, they can also lose the enzymes to more efficiently digest things. So if you only have it once a week, like these legumes, actually you might find you get more symptoms as well as you're having a much bigger portion. So you kind of need to think of it like your pet or a super skill or something, whatever you want to think of it, needs to be fed every meal that you're having. So, whether it is those phytoestrogens or just the super sex, that's kind of my nerdy self rule. Even if I'm having chocolate, right? White chocolate, no benefit for my microbiome, not even dark chocolate. I'll have a handful of almonds or bite a carrot stick. It's just that headspace of
that's a good idea.
Treating my taste buds, but also nourishing my microbiome, which, we're discovering it's obviously hormones is so powerful there, but things like our mental health, our heart health, all these, even osteoporosis risk, our microbiome's got a role in. all these things obviously become more important when we go through the menopause as well. So it's got far-reaching benefits.
And what about probiotics?
Yeah. So this is obviously a very big passion point of mine because I did my PhD in probiotics, and the way that probiotics have been marketed is just not scientific. So the way they're marketed is if, you know, you want to boost your gut health, or if you've got poor gut health, i.e. like in the menopause, take a probiotic, that will solve it. There's literally no clinical evidence that's ever shown a probiotic can help with general gut health, i.e. increasing microbial diversity. To improve your gut health,
right.
It's the plant diversity and the fermented food.
Right.
But that's not to say probiotics don't work. We just essentially have been using them incorrectly.
Right.
You know, all of the scientific studies out there, in fact, we have the World Gastro Organization have guidelines on probiotics, clinical guidelines, right? And it says, you know, for different indications where there's good evidence, you take this specific strain at this dose for this duration. So, for example, if anyone goes on antibiotics...
Right, that's what I was going to ask you next, yeah.
So the World Gastro Organization guidelines for probiotics say that you should take the LGG bacteria at 10 billion units twice a day throughout your antibiotic period. So there are these guidelines out there, Naomi. It's wild. But that formulation didn't actually exist on the market. Like, wild.
So you couldn't follow. You could not follow the guidelines.
So here I am, obviously doing the PhD in gut health, being into this space, knowing the guidelines, seeing people in clinic, and being like, I should be recommending this, but that strain doesn't exist on the market, which is why I developed smart strains. Because not because I wanted to start a business. Like, I'm a scientist through and through. I'm a huge nerd. But there was just the products weren't available, and no company would listen to me. I was like, look, here are the guidelines, right? This is what you need to change your formula to so we can use the science. They just wouldn't do it. It is frustrating when companies target people, you know, who are going through menopause and like make them think. In fact, there was a survey, I think it was like in 2,000 people, and they showed that menopausal women were spending the most on probiotics, and actually 20% of them were spending between, I think, 350 and 500 pounds a year, which is quite a lot.
Yeah.
Yet I think it was like 8 in 10 over the whole survey, people showed they weren't having any significant benefits, right? And it's just because we're not using them the right way. Right. So like if you want to...
So you're replacing something that could easily already be there and not replacing what's not there.
Exactly.
Right.
So it's kind of like supplements, right? So if you have iron deficiency, we don't go and recommend a vitamin D supplement. No. We expect the iron one. Yeah. You need to be very specific. So for menopause kind of symptoms people experience, there is a bit of evidence for recurrent thrush as an adjunct therapy to antifungals. Having specific strains, again, it's not just any generic strain, right. Specific strains reduces recurrence by nearly 3 times after six months. So they can be, again...
The science makes sense, doesn't it?
But again, we need to be very specific. And I think that's where my recommendations for people is like, if you have any issues, right, and you're like, I want to try a probiotic, or a company saying, look, this is for women's health, you need to ask them, has there been a human clinical trial or a blinded clinical trial with a placebo to take out that effect? And if they say yes, like, okay, what element? Is it the bloating? Is it the night sweats? Like, what has it shown to have a benefit in? And then if there is a benefit in what you're after, then yeah, take it. But most cases there won't be any.
One thing that I thought that we should cover is red flags, because like with all menopause symptoms, there is always potential for them to be something else. And I think gut symptoms, particularly, women are very quick to dismiss as just constipation, just diarrhea, I'm just passing a bit of blood. Oh yeah, I've lost a lot of weight and I don't. So I wondered what your experience was of sort of seeing patients kind of, because do they self-diagnose before they come to you? How do they come to you? And how often do you see things that need?
Yeah, it's more of just, you know, where they get symptoms and actually they do come to me because they're not sure about the symptoms. And I feel people are more open about their gut health nowadays, but obviously speaking out about gut issues is a personal one, because my grandma, like, she was like diagnosed. So if she had spoken up, and she was of that older generation where, you know, you wouldn't talk about the fact that, you know, you were having blood in your stool, or that the bloating was constant and no matter what you ate, it was kind of still there. So yeah, I mean, I think that's one benefit of social media is people are now speaking up a bit more about it. But I think it's so, so important. Like you said, if you're getting these symptoms, don't just, you know, go, just the menopause, right? You know, cervical cancer, all of those sorts of things, you know, bloating, is one of the symptoms. So go to your GP, just get some quick, easy tests.
Yeah.
Don't get embarrassed. It can save lives. Like early diagnosis saves lives.